Today's our topic is puberty in males, that is, sexual maturity in males. Puberty means sexual maturity. Puberty is the age at which the reproductive organs become functional. Sex organs start to produce gametes and also sex hormones. In males, the puberty occurs at the age of 12 to 15 years under the influence of testosterone. The secondary sexual characters are appear. Thereafter, it remains functional throughout the life. What happens in puberty in males? So, during the puberty, acne comes on the face of males. Then, facial hairs are appears in male. There are change in voice. Breast grow in size. Also, mood swings are appeared during the puberty in males. Also, genital organs are going to grow in size. These are the various changes that occurs during the puberty in males. Puberty or sexual maturity in females. The reproductive systems become functional at puberty. It is characterized by the menstrual cycle called as a menarche. What is menarche? Menarche is the time in girl's life when menstruation first begins. During menarche period, menstruation may be irregular and also unpredictable. Menstrual cycle usually occurs at the age of 10 to 14 years. However, unlike in males, the mature female show cyclic changes in their reproductive system, that is, the menstrual cycles. This cycle continues up to menopause. Menopause normally happens at the age of 45 to 50 years. The female is unable to bear children after the menopause. Menarche, menstrual cycles, and menopause are controlled by the gonadotropic hormones. Menstrual cycle. Menstrual cycle, also called as ovarian cycle. Menstrual cycle is the characteristic feature of all primates, including human. What is the menstrual cycle? Menstrual cycle or menstruation is the normal vaginal bleeding that occurs as a part of women's monthly cycle. Every month, your body prepares for pregnancy. If no pregnancy occurs, the uterus sheds its lining. The menstrual blood is partly blood and also the partially tissue from inside the uterus. The menstrual cycle is an important characteristic of all primates. Primates are any animals that belonging to the group of humans, monkeys, etc. During menstrual cycles, a lot of various changes are occurs in ovary and also the female reproductive tract, mainly in the uterus. These changes take place under the effect of gonadotropins and the ovarian hormones. The cycles are repeated with periodicity of approximately 28 days. The middle of each cycle is characterized by the release of an egg. This egg in every cycle comes alternately from one of the two ovaries. This cycle is divided into 4 phases. During menstrual cycle, various cyclic changes are occurs in the ovary and female reproductive tract, especially in the uterus. These changes take place under the effect of gonadotropins and ovarian hormones. Gonadotropin hormones. Gonadotropin hormones synthesized and released by the anterior pituitary gland, which act on the testes and ovaries to increase the production of sex hormones and stimulate production of either sperm or ova. Follicle stimulating hormones and luteinizing hormones are main gonadotropin hormones. Menstrual cycle or ovarian cycle is divided into 4 phases. First, menstrual phase. Second, follicular phase. Third, ovulation phase. And fourth, luteal phase. Now here we discuss one by one all the phases that occurs during the menstrual cycle. First phase of menstrual cycle is menstrual phase. The beginning of each menstrual cycle is taken as the first day, where lots of blood takes place. It lasts for the 5 days. Menstrual cycle is a natural process controlled by 4 hormones. These 4 hormones are follicle stimulating hormones, luteinizing hormones, estrogen, and progesterone. One of the several follicles in the ovary start to develop along with the oocyte present in it under the effect of follicle stimulating hormones. It means that number of follicles they are going to develop in the ovary under the influence of follicle stimulating hormones. These developing follicles secreted estrogen. In menstrual phase, endometrium of uterus break down under the effect of prostaglandin release due to the decreased level of progesterone and estrogen. Prostaglandins are found in nearby all the tissues and organs. They are produced by almost all the nucleated cells. They are act on endothelium, uterine, and the mast cell. They are synthesized in the cells from the fatty acid called as arachidonic acid. During menstrual phase, endometrium of uterus breaks down under the effect of prostaglandin. This prostaglandin is released due to the decreased level of progesterone and estrogen. Here, estrogen hormones is secreted by developing follicles. These are the developing follicles. These developing follicles secreted to the hormones called as estrogen. Now, progesterone. Here, corpus luteum secrete to the hormones called as progesterone. During the menstrual cycle, in menstrual phase, a lot of blood, tissue fluid, mucus, endometrium lining, and the unfertilized egg is discharged through the vagina. Endometrium of uterus break down in the menstrual phase so that the endometrium lining become very thin during the menstrual phase, that is about 1 millimeters. The menstrual discharge continue for an average of 5 days. In menstrual cycle, from the female body, blood going to discharge, but this blood does not clot due to the presence of fibrinolysin. Menstrual phase occurs when an ovulated egg does not get fertilized. During these 5 days, many primordial follicles are developed into primary follicles. Then few of them they are going to grow into secondary follicles under the effect of follicle-stimulating hormones. Follicle-stimulating hormones is secreted by the anterior pituitary gland. Pituitary gland is located in the head region of human. Second phase of menstrual cycle is follicular phase. This phase is the duration between the end of menstruation and the release of ovum during ovulation process. In follicular phase, Graafian follicles rupture and ovum are released. This process is called as ovulation. Duration of this phase is more variable than the other phases. Generally, it extends from 5 to 13 days of menstrual cycle. A few secondary follicles proceed and develops into Graafian follicles, but usually one of them develops into a Graafian follicles and the other secondary follicles they are going to degenerate. This process of degeneration of other secondary follicles called as atresia. Developing secondary follicles secrete the hormones called as estrogen. The stimulation for the proliferation of new follicle is influenced by the stimulate release of follicle stimulating hormones. Now this endometrium begins to regenerate under the effect of gradually increasing quantity of estrogens. Regeneration also involves formation of endothelial cells, endometriums or uterine glands, and network of blood vessels. Thickness of endometriums reaches up to